invite a health and safety professional, and I'm so pleased that we found Joe to be our panel participant covering health and safety. You can see here, he's a modern leader with knowledge of both occupational health and safety. And he's the winner of a 2017 National Safety Council Rising Star Award with 15 years experience in a variety of fields, including the chemical industry, emergency response, fleet safety, and healthcare. He has a number of certifications, and I know I'm going through everyone's bios quickly. We will share the details, all of the slides on the My ASQ website. Note that he's a member of the American Society of Safety Professionals, the Philadelphia chapter. And Joe, I'm gonna let you go into your presentation. I'm gonna go to your first slide.
All right, appreciate it. Well, back one slide, people might say, why did I pick that picture? And you know, what I wanna say to people is, you know, wow, that was only 2.5 years ago. You know, we're in a huge crowd of people. Eagles won the Super Bowl. It was one of the greatest times, I think, in many of our lives. And what I wanna tell you from that is, don't get drawn into the negative, right? There's a positive side to this. We're going to come out of it. And like Jay talked about, we're going to learn a lot of stuff from this. And I think that we're going to be able to apply that moving forward. So thank you. If we could just get started.
Okay.
But, you know, so really, what do we need to know with this? You know, and from the safety perspective, right, we're operating off that whole safety hierarchy of controls, right? We're talking about elimination, engineering controls, administrative controls, and PPE, right? Well, what have we been talking about the whole time here? We've been talking about PPE and wearing masks. So PPE is really supposed to be your last line of defense and not your first. So I've had people challenge me, you know, and ask the question, was elimination really possible? And, you know, my answer to that is simply, you're not able to eliminate the virus. You're certainly able to eliminate risky behavior, right? And that risky behavior can be as simple as bringing a group of people back into a building that's not set up to have 50 people in it, and all of a sudden, you know, you're contaminating folks. I think that our policies really need to start to think in a broader perspective, right? They shouldn't think in the world of just COVID, and I think that was just said too. We're going to need to know this ahead moving forward. These policies need to speak in terms of, do we want sick people at work? And I think the simple answer to that is no, we don't. We should have them speaking more towards, how are we able to keep sick people out of work, and how do we utilize the resources of someone like an occupational health provider to help you verify that that's not something that's being abused. If you've had remote work options, you know, you really need to assess from a safety perspective, why are you rolling that back if the person at home is in the same meeting as they are in the office with 50 people? Again, it's about trying to, you know, limit your risk. We do know that there are a number of disinfectants that are effective at killing the COVID-19 virus. If you go on the EPA website, it's called List N. It has both the material and the amount of time you need to have a contact in order to kill the virus. And last but not least, you know, OSHA has set a set of criteria for workplace exposures that goes everywhere from very high to low. And it's important for all of you in many different industries to really know what is your level of exposure there. You know, healthcare obviously can operate in very high and high, you know, all the way to just sort of being, again, these folks working at home can be low. But one of the things I encourage you to do is, again, don't think about this stuff on a site level. Think about it even on a microsite level. You may have great social distancing in your offices, and then you may have a development lab where 4 people are working, but really only 2 people fit, and that may not be the best setup. So something to consider. Next slide, please. So I kind of talked about it in the last slide, but, you know, what framework and technologies can assist us? You know, what I'm trying to get at with that is that you need to have an assessment process, regardless of the size of your business. It can be as simple as a questionnaire, you know, just somebody giving a testamentary statement saying that they're not sick at this time. And it can be as advanced as these kiosks. It's important to make sure that if you are going to have either of them, if you're going to control access or you're going to do temperature checks, you need to make sure that your entry into the building is controlled. Because we've seen folks that decide they don't really want to go through this process, so they're going to take the other door and they're going to circumvent the process. You know, one of the things, regardless of how you're getting your folks to tell you and testify that they're not sick, you need to make sure that they don't get into the building, right? Because a failure of the process is really allowing them into the building before they declare they're sick, and now they're around everyone else. So again, one of the things I want to reinforce is control your access points, make sure that your workflow around the building makes sense. You know, you can control doors and all that in all sorts of non-emergency situations. Fire alarms go off, that's an emergency situation. We would deal with that accordingly. But again, to get back to the policies, it's also very important to know what you would do if you were turning someone away at your door for example, a high fever. This is where it's important to have the policy written. And again, I would be conservative with it. Allow the person to leave, allow them to go home. If you think they're abusing it, have one of your providers evaluate the person through a fitness for duty exam. Next slide, please. So, you know, again, we talked about it. Personal protective equipment is one of the things that I think has gotten more attention now than it ever has. And there are obviously different types of respirators, and we have everything from, you know, the handmade handkerchiefs, the gaiters, people that are sewing masks, all the way up to surgical masks and even an N95 respirator. One of the things I want to encourage you about the N95 respirator is, sure, we know that it's 95% efficient, but that's in optimal conditions, right? And that really means that, you know, you have been fitted for it and that your fit test is working. And it also means that, you know, you're not like me and you're clean shaven and you have a good seal. So understand that this is not a mask. It is a respirator. OSHA defines a respirator as you need medical clearance and you need a fit test to do it. And even in the cases of when there may be a voluntary use, someone saying, well, my work's not requiring it, but, you know, they gave it to me, I'm gonna wear it. It's still required. So just understand that. In Spirit Health, you know, as a large health network in South Jersey, we have a number of different hospitals. We have approached it with the surgical masks for the most part. There have been some areas that are N95, but we mostly approach it with the surgical masks. That's what I would encourage you folks to do, but they do not seal against the face. You know, they are sort of moisture resistant, and about 70% of the air is moving, you know, through the mask. 30% is going out the sides. A cloth mask, you know, obviously it's impeding even less, right? There's only about 2% of the air going in. So obviously they flow a lot better. And for that reason, I think that folks prefer them the best. The next slide, I really want to talk about, you're going to encounter folks, because we are right now, folks that don't feel that masks are of benefit to them. This isn't a political argument in my world. This is really about how do we protect people, and I think that we should want to protect people as much as possible. And so by you wearing the mask, you're showing you care about other people, and I think that's extremely important. There was a journal study that was just released, and the journal is called The Physics of Fluids, and the study was called Visualizing the Effectiveness of Face Masks in Obstructing Respiratory Jets. That's a mouthful, but in that study, I've selected certain pictures because I wanted to demonstrate what these masks are doing. And they actually had a control group. And the interesting part about the control group was they were completely unmasked. And they found that those jets in that study went about 8 feet. This particular mask that you're seeing on your screen right now is just a handkerchief. It's not even the sewn type of masks that we've seen. And there is some effect. And when we get to the end, there's a table which will show the actual findings. But I think that one of the points, and if we go to the next slide, you'll see, is that masks definitively have an impact on the spread of this virus. And so this particular one is just a homemade face, you know, mask that's been sewn. Again, you can see even better than what we just saw with the bandana. And if we go to the next slide, you'll see that this is a mask that was purchased at CVS. And this particular mask, as you can see, even less, you know. And so what I want to get back to is the table sort of down below, and you can see that uncovered again, average jet distance 8 feet. The bandana, which I personally don't recommend and don't want my family doing, 3 feet 7 inches. You've already cut it in half. You get down into, you know, these stitched masks, you're at 2.5 inches, and I mean that is helping you social distance. You don't want to be in the you know, 8 feet range and having someone next to you. So that's the point of that study.
Okay.
Yes. So, you know, before I was in health and safety, I was in emergency response. And so, we would see folks that had exacerbations of, mental health conditions and PTSD. And in a lot of cases, we would call them mental health injuries, right? They're acutely onset. And this can be folks that, have dealt with treating a patient that has it. It can be family members that have seen their family have it, and it can be people that have been sick. And so one of the things that I want to bring this back in perspective that you may begin to see is start to understand what your employee assistance program provides, because you may begin to see workers who are concerned about leaving home. You may begin to see people who are worried about what are their kids going to do for school, and a number of different situations like that that are really going to drive stressful situations. And so let me bring it back to PTSD. I'm actually going to quote a Broadway performer because I want to bring the safety end of this in. You're going to say, how can a Broadway performer bring in the safety end of this? But this is about somebody that experienced PTSD, and her quote goes, "It becomes difficult to deal with everyday life because you have hid your soul in a dark corner so it doesn't have to face the dangerous world of trauma. Without your soul, you're only half a person, a machine who is constantly running from reality." So how do I bring that back to safety? Well, in the safety world, we know things about machines, right? And the one thing we can guarantee is at some point, a machine's going to break. So again, it's really important for everyone to look out for their coworkers at this time, because again, there's a very stressful period of time that we're going through. Physical deconditioning is another thing that you really need to consider. I know that it sounds silly, but a lot of folks have been at home and they're not taking that walk across the parking lot or across the office. And so now you're going to bring people back to work that maybe have not done things on a production line for a while, or maybe they've done different types of work. And so the risk of injury is really there. And it's something that we personally are seeing at our end, and we're starting to treat. We're starting to begin to see a significant surge in work injuries. And it's not just physical deconditioning, right? It could be mental deconditioning. You may not have had folks working in teams. You may have made adjustments from a social distancing perspective that now, when you put it out there, you've created a new problem, right? We've social distance folks, now they're reaching too far, now they're hurting their back, as one example. The point I'm trying to make is just to understand that there's going to be an adjustment, and that may require you to have a tune-up day, or it may require you to scale up your operations once you make these adjustments, and have the folks on the lines, or have the folks that are doing these procedures and processes to give you feedback about whether or not this social distancing is the way it's supposed to be in helping you, not just with the virus, but also not creating a secondary problem of an injury. So there's a lot we don't have, right? And I think in the health and safety world, and for us, I think one of the challenges for us is that we have not had consistent guidelines to go by, and that's me being a healthcare provider. I can basically tell you that we've seen guidelines change 3 and 4 times in a week, and for us to try to give that to a company and try to give the feedback to them is a challenge, because one minute we're telling you to quarantine for 10 days, the next minute is 14 days, and so on. So I want everybody to understand that we're doing the best we can as we try to navigate this, and you guys should try to stay up on it too. But there's no single process or one size fits all approach to mitigation. And I think that that's probably a stressor of safety and quality people alike, right? We like to be able to have a process which can narrow it down. And I think you can do it, but my approach is really about making sure that you assess, again, what your risk is and how you eliminate that risk, because every business is different. We don't have quick, consistent environmental results, right? We don't have a Draeger tube that can test for it yet. We don't have a dosimeter that can show us how much we've been exposed to. And in my view, if we're checking for that in a workplace, it's probably too late, right? We've already had the person in the workplace, and your chance of exposure is already there. Buildings were not designed to socially distance in many occasions, right? And so it's something to think about in terms of your HVAC system. Can you introduce more makeup air into your processes to get more air exchanges? Can you eliminate certain areas that you used to use that were much too small, and give yourself more socially distant areas? And the other thing that I think that we have seen, and I think for me, this is one of the more troubling things, is, we have seen issues with buy-in at all levels. And I think that if you're a quality person or you're a safety person, you've already had this problem, you know. And I think that for us, one of the most important things to do here is make sure that whatever process you design, and if that's hand sanitizing as soon as you get there and filling out a testamentary form, making sure that you always wear your mask, your leadership needs to